Dr. Schalk du Toit, Executive Committee member of the Opthomological Society of South Africa, joins us now for this discussion. A very good evening to you, and thank you so much for speaking to us. Perhaps if you could just first start by explaining diabetes, retinopathy, and what are the symptoms? How far gone should you be in your diabetes journey for this to emerge?
Hi, it's a pleasure. Thank you for having me. So unfortunately, as you mentioned, diabetes is, the incidence is skyrocketing, and the biggest complication that we see is diabetic retinopathy. It's unfortunately a silent disease, and it only becomes symptomatic late on in the disease process. So unfortunately, some of our patients walk around with their diabetes for quite a number of years before they start undergoing treatment. So as you know, then as time goes on, the diabetic retinopathy can develop in the background, and these patients will eventually, only late in the disease process, start developing symptoms. So the symptoms that they can start presenting with is loss of vision, floaters, things like that, and these are all signs of diabetic retinopathy. So the diabetic retinopathy is basically a problem in the back of the eye. So the retina is a very sensitive structure there. And in a patient with diabetes, the retina starts developing swelling and bleeding, and if it's not treated properly, the patients unfortunately can develop retinal detachments or retinal tears, and that can eventually lead to permanent vision loss. And as you mentioned, it's one of the leading causes in South Africa and the rest of the world of permanent vision loss. So it's quite a serious condition, and one that is unfortunately often the patients only present very late to us.
And how different is this to glaucoma?
So it's a very different disease entity. So glaucoma is a condition of where the optic nerve is damaged, usually by high eye pressures. The two conditions are similar, that both of them are quite silent, so there are not a lot of symptoms, unfortunately. So in glaucoma patients, they over many years develop progressive vision loss. Usually it's only in the peripheral vision, and then later on they become symptomatic in the center. So these patients are often also diagnosed very late. And diabetes is very similar in this manner, that the patients are often not aware that they are developing diabetic retinopathy until a very late stage of the disease. So therefore, it's absolutely crucial that we try and screen these patients quite early on, so that we can pick up a problem early and then start interventions.
But both are caused by diabetes?
No, glaucoma itself is a disease condition that is not specifically related to diabetes. So there is a slightly higher incidence of glaucoma in diabetic patients, but glaucoma is not caused specifically only by diabetes. It's most commonly associated with a strong family history. It's also a little bit more common in nearsighted patients, but not specifically due to diabetes.
So how do people, particularly those without access to medical care, either because they live far from an institution for primary health care, or just even the costs of going to an ophthalmologist, how can you remedy the fact that people can't afford to get there, or they don't know that they need to be having these regular tests?
Yeah, so I think that's the crucial thing now. So we need to really get the patients screened. So there are too many diabetic patients for ophthalmologists to look after, or at least to screen. So what we really need to do is to try and work with government agencies and local communities, so that we can set up screening institutions. So it's actually quite simple to screen for diabetic retinopathy. One basically just needs a fundus camera, which is a special camera that is not extremely expensive, and that can take photographs of the back of the eye. So these cameras take the photographs, and typically they are then uploaded into a software computer program, and using artificial intelligence, they can very accurately give us some feedback on the patient's eye, whether they need to be referred to a specialist center or to an ophthalmologist who can then look at the patient and decide if they need any treatment. So I think the most important thing now is that we try and develop these systems so that patients without access to medical care, to ophthalmologists, so that they can have at least access to these camera systems at least once a year. So they are being rolled out. We are having some challenges, unfortunately. The screening systems haven't been rolled out efficiently enough and widely enough, but it is an ongoing project, and that is specifically why we, as the Ophthalmological Society of South Africa, we're trying to get this information out there, and we're trying to work with all the stakeholders, the government, local communities. We're trying to get these systems up and running.
I believe that there is what you call in-home evaluation that can be done, and there are providers for this.
There are some systems being developed for at-home testing, but they are not freely available also, and they come with significant cost. So I think the most efficient ways at the moment is to have a community-based screening system set up. These can be in any rural clinic. It can be in a mobile clinic as well. Many of the optometrists also carry cameras in their systems, and we're hoping that general practitioners will also start getting more cameras so that the patients can be screened early and efficiently and then referred appropriately.
Besides being, I often find this disagreement, and I don't know if it's just between medics or the understanding from patients of being pre-diabetic, what that actually means, and actually being considered diabetic. Firstly, can we just start with that explanation, but also then talk us through who is then susceptible to diabetic retinopathy?
Yeah, so pre-diabetic patients are patients where their diabetic sugar levels are tending to be higher, but they are not consistently or sufficiently high enough to make the diagnosis of diabetes. So these patients typically need to be treated with lifestyle advice so that they can try and lower their weight, get more exercise, change their diet. Sometimes if they are high risk and they carry other conditions like heart disease or cholesterol, they might even be treated for the pre-diabetes with diabetic medication. Once their levels are high enough to be considered in the diabetic levels, then they would of course be treated with the appropriate medication. So with regards to the retinopathy develops typically over time. So a patient that lives long enough with diabetes has a very high chance of developing diabetic retinopathy. In fact, if you live with diabetes for more than 25 years, there's most likely almost 100% chance you will have some form of diabetic retinopathy, although it might not be very severe. But about 1/3 of all diabetic patients will develop some form of significant diabetic retinal disease. So the patients with a pre-diabetes will uncommonly develop diabetic retinopathy, but of course over time they too might develop early changes.
All right, thank you so much for your time, Dr. Schalk du Toit, Executive Committee Member of the Ophthalmological Society of South Africa, speaking to us about diabetes retinopathy and the increasing numbers that we're seeing in this country.